And today you had me come to your office to help you learn to do it more, let's say, I don't know, precisely or more correctly, or to actually be overseen during the process of learning how to do it. So how did you find the learning experience of having one-on-one in-office training specifically for DTR?
For folks and dentists that are considering to do this and provide this therapy and this treatment in their office, they have to do this. This is something, yes, you can learn some of the fundamentals, some of the steps and the protocols, but you've got to get Dr. Kerstein in. It was a great experience. I felt very, very comfortable. I felt like he got into the meat and potatoes of everything. He went through, set up the software, made some changes in the settings, did a lot of little extra things that would have taken, a lot more time on my end to read, figure out, and learn. And most dentists are hands-on. They learn fastest hands-on. So I'm telling you, you've got to get this guy into your office. You've got to experience this. This is something that if you're providing prosthetics, if you're doing implants, if you're restoring teeth, you've got to have this technology in your office. Because if you're not, you're doing your patients a disservice.
Well, that would be referring to the T-scan and possibly the EMG. The value of the one-on-one training, which is not possible to do in any other way. For example, coming to a course, because you came to a course to learn DTR.
Right.
The value of it is if you came to watch me, you can't do the work.
No.
You can see me do the work, but you can't do the work.
Right.
And so if I come to you, you're doing all the work, right? And I help you see it clearer or guide you, but you get to do it hands-on
Yes.
with your own patients. And that's really what I see as being the biggest value.
Huge value, huge benefit. Our last patient, I felt very, very comfortable, but he guided me throughout the first, patient, second patient. But I feel like if the value that he's going to bring to coming to your office and letting you do the work, you're going to learn 100 times more than what you would sit in a course.
Yes. And do you feel now after a day of it, because we did see the one patient we couldn't treat because of how she was aligned, that you understand better how to diagnose, better what to look for in the mouth, more acute to what the T-scan and the EMG will show you than prior to when I came? Because you've been working with the technologies for a few months now.
Yes, I've had the T-scan for I've had my first T-scan for over a year. I bought my second handle 3 months ago after the course, and bought the EMG, which I got over a month ago. Although I treated 2 of my staff members. After today, the things, the pearls, the content that I'm going to take away from this is invaluable. You're not going to get this just going to a course. You have to have him come in.
And you also videotaped the session, which was recommended by Dr. Sutter.
Correct.
And the reason for that was?
If you don't video this, you're going to miss a lot of things. You're going to have to go back and watch how Dr. Kerstein interacts, how the questions he asks, the steps he takes, the protocols. There's a lot of things that you're going to forget. You're not going to remember unless you have the entire day videoed. I don't care what it costs, do it. It's going to be worth it, because this is going to bring so much value to your practice and your patients. And don't waste this day. You need to be able to go back and relearn or refresh what you did. But it's highly, highly recommended to have someone video the entire day in your office.
Is there anything else you'd like to add that we didn't discuss about either being a patient or being a doctor now learning to do this?
No, I'm just ready for the next step. I'm going to continue my journey to the next level of the certification. But I would encourage any dentist that has a passion for dentistry. This is something, it doesn't matter what stage of dentistry you're at. This is something that you can bring to your practice. It's going to reinvigorate your practice, your team, your patients. They're going to be your biggest advocate if you can actually take care and relieve them, because there are so many patients out there that have these symptoms, that have these problems, that are just struggling and they don't know what to do. And you can be that answer.
Well, you brought up the certification, which we didn't talk about. So what are your goals with being a DTR certified doc?
My goal is to be the go-to dentist in Central Arkansas. My next step, of course, will be to take the exam. From there, I'd like to go to Dr. Nick's office, see a live patient day with how he treats and what he does in his office. And from there, ultimately, my goal would be to teach other dentists, to share the knowledge that I'm going to gain over the next, 10, 15, 20 years, and share that with dentists as this becomes more and more relevant and more mainstream. But my goal is to spread the word.
Well, the certification affords you a chance to be noted as a trained disclusion time reduction doctor, which people will seek you out, and you'll have access to your contact information through the CNO Certification website. So that allows you to have impact possibly beyond Central Arkansas.
That's right.
People in other states may come to see you, as has been happening, people coming from all over the world to get this process done.
That's right.
So it's a great thing to become certified. But the question about the certification really is, do you think that you would have been able to be competent without having a day of definitive training?
Absolutely not. Absolutely not. You're talking about an individual that has been researching and studying this for 33 years. There is no way the majority of dental professionals can take this, implement it without messing up or having issues or creating more problems for patients. There's going to be a much higher risk for that if you don't bring Dr. Kerstein or Dr. Nick in for your DTR training.
Well, thank you for taking the time to be interviewed. I'm glad you feel a lot better.
Feel great.
You would be representative of most patients. Not all have a really dramatic improvement. Some have a moderate improvement that definitely helps their quality of life. But most have a really significant improvement and become appliance-free, night guard-free, and live with a lot less pain and chronic symptoms. And you've also, undertaking the education is really going to help you deliver that care to people. And of course, there's too many patients for any one person to treat. So I'm glad you're coming on board to be a Central Arkansas expert. It'll be a great thing.
And to all my small source docs, get on board. We're coming for you.